Good day to everyone. Visual diagnosis, inspection in the eyes. Visual diagnosis of the eyes. Before discussing the eyes as the diagnostic tool, it is important to state that it is the Chinese medicine version of eye diagnosis that should be utilized in a Chinese medicine diagnosis. Whereas iris diagnosis is an effective and prescribed diagnostic tool, it should not be used as part of a Chinese medicine diagnosis. This is because iris diagnosis is based on the Western medicine anatomical and physiological model. This means an observation of an imbalance in the kidney. For example, in iris diagnosis does not necessarily mean that the kidneys, as understood in Chinese medicine, have an imbalance and need treatment. Conversely, one can imagine a situation in which there is an obvious pattern of kidney yin or kidney yang too. Without this manifesting as a problem in the person's physical kidneys, therefore, this will not register with changes in the iris. It is important to keep the diagnostic tools from different physiological and pathological systems separate. Otherwise, there is a risk of formulating a treatment principle based on false premise. There are many different aspects and levels to ophthalmic diagnosis. Most of us have taken advantage of some of these even before we started learning and practicing Chinese medicine. Chinese medicine has just taught us to focus our attention on these signals and systematize the information that they give us. Shen, one of the first things we determine, both consciously and subconsciously, on meeting a person is how much vitality and radiance there is in their eyes. From a Chinese medicine perspective, this will inform us about the person's Shen. In the same way that we in the West say that the eyes are the window of the soul, Chinese medicine states that Shen can be observed in person's eyes. There are two definitions of Shen that are relevant here. Shen meaning vitality and radiance, and Shen meaning spirit, mind, and consciousness. A person who is in good health will have eyes that are bright and sparkling. It is possible to have direct eye contact with them, and this will feel comfortable for both persons. A person with heart issue will have difficulty maintaining or feel uncomfortable with direct eye contact. This is because their Shen is undernourished and they are therefore often very shy. Direct eye contact can feel too intense for them. It can also seem as if there is just too little sparkle in their eyes. It can remind you of eyes of a person who is exhausted. The Shen is simply not shining brightly enough. It can also be difficult to have eye contact with person who has heart and liver qi stagnation due to the lack of movement of their Hun and Shen. The difference between this and the former situation is that a person with heart issue will have a tendency to look away, and they will lower their gaze when you look directly into their eyes. And a person with heart and liver qi stagnation, it will seem as if they are staring inwards, are unable to look outwards, and are locked within themselves. This is reflective of their mental condition. Their Hun, which normally looks forward and outwards, is inhibited in its movement by the stagnation, and the person can have difficulty in seeing a future of themselves. An overactive liver can in turn result in a person having very intense, rigid staring eyes. They stare at you and distinctively you want to look away from them because their gaze is too intense and piercing. In this case, the Hun is overactive it is very focused on goal of its own individual vision of the future. This type of person is used to being in control and getting their own way. When heat agitates the Shen, it becomes restless and the person can be manic. Their eyes will become restless and frenetic. This is because Hun follows Shen in its entering and exiting. When Shen is agitated and thereby overactive, Hun is forced to follow its movement. This results in eyes that are constantly shifting their point of focus and the room. When Shen is when Shen is obscured and blocked by phlegm, it can have difficulty radiating onwards, thereby creating a barrier and making contact with other people's Shen. The eyes will appear matte and blurry. The person will often have the feeling that they are not fully present and in touch with the outside world. It is as if they are sitting in a bell jar or there is a mist between their eyes and the outside world. Observation of the eyes. Lack of eye contact, the significance of this is heart tissue. The staring and pursing eyes, liver Qi imbalances. Darting or restless eyes, heat agitating the Shen. The blurry or matte eyes, the significance of this is phlegm blocking the Shen. And the lack of brightness, the significance is the liver and the heart Qi stagnation or heart Qi Shu. The zone in the eyes. The eyes can be divided into different zones. As with the ears, feet, and other parts of the body. When there are color changes in these areas of eyes, this can tell us something about the corresponding zang-organ. It is important to remember, though, that the condition of other organs may also affect this area. Condition of heat, even not in the lung, will make the sclera in the eye redden and become bloodshot. Heat's young nature means that it will always rise up, and therefore all forms of heat in the body can affect the sclera of the eyes. The zone in the eyes, the pupil represents significance of the kidneys, the iris is the liver, the sclera, the lung, the canthus is the heart, the lower eyelid, the stomach, and the upper eyelid is the spleen. The colors in the eyes. Various imbalances can affect the eyes. Although the eyes, when taken as a whole, relate to the liver, the colors in the eyes can be affected by other organs and by Qi. Heat, especially Qi heat, will make the eyes red. Heat is young in nature and therefore rises upwards. Systemic heat, unless it is bound together with dampness, will always rise up to the upper part of the body and to the head. This is why it is most often the head and not the lower part of the body that manifests symptoms and signs of heat. Heat manifests with redness of the eyes, will often have its root in liver fire, stomach fire, or an invasion of exogenous wind heat. The heat can be so intense that it affects the fluids in the eye. This will result in dryness as the body fluids evaporate from the area, or in the inflammation when the heat is so intense that it becomes toxic heat. Yellowish eyes result from condition of damp heat. Shui Shu and Shui stagnation can also cause the eye to turn yellowish. Less common, but still of relevance, are the colors green and blue. A bluish tinge to the eyes may be a sign of cold, and greenish tinge may indicate liver wind. This is one of the examples of the eyes. Inflammation and styes. Inflammation and styes in the eye have two main root causes. They can result from an invasion of wind heat, or when heat that has been generated internally rises up to the eye. Often the heat will have ascent from stomach via its channel connection to the eyelid. The heat can damage the fluid and be so intense that it generates toxic heat. Tears and mucus in the eyes. In theory, sleep and secretion of mucus in the eye can be observed by the therapist. Although this is not usually the case, and in practice, because the person will often have removed it before you meet them. This means it is best to ask the patient about it instead. In the same way, that phlegm can accumulate in the lung or in the respiratory passages. It can also accumulate in the corners of the eyes. This is because the corner of the eye is cavity with which there is limited flow of qi. Fluid can stagnate in this cavity and turn into phlegm. This can be seen in the morning after the eyelids have been closed for several hours, resulting in a lack of movement of qi in this area. A person with tendency to have phlegm may often experience a small blobs of mucus in the eyes forming throughout the day. Watering eyes can be due to the circulation of fluids in the area being disturbed by exogenous qi or a liver imbalance causing the movement of fluids in the eyes to become chaotic. Liver imbalance that lead to the eyes watering can be both true and qi in nature. Tears may be spontaneous, but they will often arise when the eyes are exposed to wind or droughts. This is consistent with the fact that the liver, wind, the eyes, and the tears are all aspects of wood paste in the Chinese medicine. The table of secretion and the mucus in the eyes. In observation, sleep and mucus in the eyes, the significance of this is phlegm. Watering eyes, this is liver imbalances, wind cold or wind heat. The styes and inflammation, this is the wind heat and stomach fire. Inspection of the eyes means to observe and examine the spirit, color, shape, and bearing of the eyes in order to assess the patient's spirit, the thermal nature of any pathogen, and condition of zang-organs. Number one, eye inspection theories. The eye and zang-organ relationship. The eye is the gathering place of essence qi from the five sang and six fu organs. The divine pivot, chapter 80, says the essence from the five sang fu and six fu flows upwards to irrigate the eyes. The heart houses the spirit and the capability to identify and visually distinguish items depend on the normal activities of the spirit. The heart is also the organ that governs the blood. It is the heart qi that provides the power to maintain normal blood circulation, which supplies nourishment to the eye. The eyes are the orifice of the liver. The function of the liver is to store the blood and control the sinews to maintain the eye's normal vision and movement. Blood is the nutritive resource for the eyes. Therefore, the spleen's function of generating blood and the kidney's function of storing essence are directly related to the normal function of the eyes. The dispersing and descending function of the lung maintains smooth qi circulation, which provides the power to maintain blood circulation. Because of this, the lung is also directly related to the eyes. This is the illustration of the eye and the zang-fu organ relationship. In liver, controls and stores blood, controls the tendons and stores the blood. The heart dominates the blood and houses the spirit. The spleen dominates the muscles. Also, spleen generates blood and essence. The kidney stores the essence, and the lung dominates the chi and transform into blood. And all of this can provide the essence, nourishes the spirit, and also the essence transform into blood. Okay, and that can provide the eyes with the uh, flexible movement, glittering, bright, shiny appearance, ability to distinguish objects, and clear vision. Thank you and for your attention, and have a good day to everyone.